How can we move past fear towards health? Great question with a great answer.
Many of us are walking around essentially waiting for the other health shoe to drop, right? Our breasts are ticking time bombs for cancer. We're just a handshake or a cough away from a deadly infectious disease. And we just put out all of these little fires with medication after medication. Because the pharmaceutical industry partners with media and they garner our loyalty through fear, right? It's as if horrible, deadly diseases are falling from the sky and they are handing out bulletproof umbrellas. But it's my passionate belief that there is a way to navigate health without fear. And I think it has something to do with empowerment. Right? Because when we make decisions from a place of fear, this myopic place, we may offer ourselves a sense of less disorder, but many times we are engendering much more complex and difficult to solve problems. So these days I partner with my patients and they work hard. They work hard at a time when they can barely lift a finger and when the prospect of bringing a prescription slip to a Duane Reade sparkles like the North Star in their dark sky. But I think that they do it because of my conviction. And I think they're also pretty curious about a process that asks the question why. And maybe they feel they deserve to explore that. Right, so these days, I have miracle cures in my practice every week. But when I was prescribing, I never had one. Really, all that I'm doing is helping patients to engage self-education. I'm asking them to start connecting dots and look at causality, right? So if I ask them not to eat wheat for a month, and then they have a bagel, and they forget their ATM PIN number, and they have a migraine for 3 days, well, good. Then we have data. We've engaged the process of learning about themselves. So I like to think of myself as part of an empowerment movement. I think you can hear the rumble in the doctor's office, in the Little League stands, and in the grocery store. We're talking to each other. We're having our babies at home. We're schooling them there. We're growing our own food, and we are finding doctors who get it. And we're doing that because we see that the emperor has no clothes and that government and industry do not have our best interest at heart. In fact, they don't even know what health is. So I'm going to ask you, challenge you, to shine a very bright light on all of your assumptions about the necessity and utility of conventional medicine. I'm going to ask you to challenge your carve-outs. Because I think that when you wipe these lenses clean, you'll have the opportunity to take back what you've given away. So as was recently quoted on my sister platform, Fearless Parent, everything you've ever wanted is on the other side of fear. So thank you.
Thanks so much for watching, and for more great clips like this, please subscribe to our YouTube channel. I've created a special free video just for you called Harnessing the Power of Community in Your Practice, and it'll give you a clinical model, practical tools that double as marketing, and strategies to develop a community of your peers. All you have to do is click on the link below.